Good morning, everyone, and thank you for joining us this day, November 24th, for the IWH Speaker Series. My name is Peter Smith. I'm a member of the scientific staff here at the Institute for Work and Health. Today, it's my pleasure to introduce Monique Gignac, who is the scientific co-director and a senior scientist at the Institute for Work and Health. She also is a professor in the Dalla Lana School of Public Health at the University of Toronto. Monique will be presenting today. The title of her presentation is, Does it matter what workers' reasons are for disclosing or not disclosing an episodic disability at work? Why and how? Just a reminder, if you do have questions that you'd like to pose to Monique at the end of the presentation, please type them into the chat box and I will read them on your behalf at the end of the presentation. For those of you who would like more information on the speaker series, you can subscribe. The address is on the slide, which is currently up on the screen in front of you. So without further ado, Monique, I'll leave it to you. I'll turn off my camera and all the best.
Okay, thank you, Peter. Welcome, everyone. Thank you for coming today. As Peter mentioned, I'd like to discuss a little bit about some research that we've been doing on whether it matters what workers' reasons are for disclosing or not disclosing an episodic disability at work. And I'll come back to this notion of an episodic disability in a moment to discuss that. I want to begin, though, by just acknowledging my colleagues, Drs. Arif Jetha, Kathleen Martin-Guinness, and Salahuddin Ibrahim, and our funding from the Social Sciences and Humanities Research Council of Canada and the Canadian Institutes of Health Research. And the funding was for two different projects, and I'll be coming back to the ACE grant toward the end of the presentation to tell you a little bit more about it. I would say over the last dozen years or more in studying chronic conditions and their impact on employment, one of the most common questions that I've heard in presentations is, should I tell my employer I have a chronic condition that sometimes makes it hard to work? And so today, the answer is not a simple yes or no, which is why you'll be here for longer than a couple of minutes. Today, I want to unpack some of the reasons that people give for their decisions and look a little bit more than at this question. I will give you, though, up front a few of my very big, broad kind of takeaway messages and come back to more specific messages at the end of the presentation. I want to just note that this whole decision, and in fact, it's decisions whether to disclose health information at work, they're often stressful and complex. They occur over time, and in other words, people often don't have to make just a single decision whether to disclose information about their health. They make them repeatedly over time. There is no single right decision whether to share or not to share. I'll come back to that. What we found in this study, which is really a preliminary study, is that the broad categories or the types of reasons that workers give are associated with reported positive or negative workplace support outcomes. And why does that matter? It's easy to kind of dismiss people's reasons by saying, well, everybody's different, it's also subjective, I don't know what to do with this information. But people are acting on these decisions, they're using this information. And so we're trying, as part of some of our research here at the Institute, to create communication decision-making tools. There's value in understanding a person's goals, and their reasons do matter. So let me just back up to begin here and talk about episodic disabilities. Many of the most common chronic conditions in Canada can be characterized as episodic disabilities. And what we mean by that is that very often conditions have intermittent limitations. So people may have periods of time when they're not limited at all at work that are interspersed by periods where people have more severe symptoms or episodes or flares of their condition. Very often, even if very well managed by treatments or health services, people will tell us that these episodes are unpredictable. People don't always know when they're coming, and so that can create a lot of stress. And also, although not always, others may not be aware that an individual is living with a chronic condition, episodic condition. And so we sometimes see these conditions as invisible or hidden. And I've provided a number of different types of physical and mental health conditions on the bottom of the slide to give you some examples of conditions that are very, very different in terms of their manifestations, their etiology, and treatment, but all could be thought of as episodic conditions. Now, recently, Statistics Canada has started to use the language of dynamic disabilities. So episodic disabilities, dynamic disabilities, the language is in a bit of flux. And what they've done at Statistics Canada is try to unpack this episodic nature of conditions. So they talk about recurrent limitations, and these are limitations where an individual will say that they have periods of a month or more, sometimes years, where they have no limitations at all, no disability. Then they talk about progressive limitations, where individuals may have periods of time with no limitations, but over time, a condition seems to be getting worse. So multiple sclerosis is an example of a progressive limitation. Fluctuating limitations, people may say they have good days and bad days, but they really rarely have a period of time of a month or more where they don't have some limitations. So these are highly variable, lots of change. Recently, in a survey we administered in June, so this is using some different data that I'm going to focus on today, we had over 1,000 individuals who were working with a chronic physical or mental health condition. And we asked the same questions as Statistics Canada. And I think it's important to note that we had nearly half of participants who told us, 47.7%, who said that their limitations were recurrent. In other words, they had a period of a month or more with no limitations whatsoever. I've combined progressive and fluctuating here. We had about 12% of people who had progressive limitations and 8% who had fluctuating. And then we had almost a third of our participants who told us that their limitations were fairly continuous. Our numbers are a bit different from Statistics Canada, and that's largely because we have a working population here, and it's harder to remain working if you have progressive or fluctuating limitations. The continuous limitations group tended to report mild or moderate limitations. And again, I think that's because it's difficult to work if you had very severe limitations. We took a look to see whether or not these groups differed by whether people had physical, mental, or both physical and mental conditions. And you can see here along the recurrent row that there was a difference. Individuals in our study who had mental health conditions were more likely, 53% of them reported recurrent limitations than the other groups. Individuals who had both a physical and mental health condition were most likely to, or were more likely, not most likely, but were more likely to report progressive or fluctuating limitations than those with physical or mental health conditions alone. And individuals, we had more participants who had a continuous limitation if they had a physical condition. But I think the bottom line that I would like to stress here in this slide is that over 40% of individuals in all the groups told us they had fairly lengthy periods of time with no limitations at all. And that's important in understanding disabilities. One of the reasons that's important is it really speaks to this choice that people have of whether or not they're going to disclose some health information. Because some people can wait it out, they can try to take care of their health and get through an episode, people often choose not to say anything at all in the workplace. We have this choice, and it's not clear to people whether or not or when they should say something. Now, previous research, which has been largely qualitative with smaller samples, a lot of samples with mental health conditions, although not exclusively, highlights that there are a real range of reasons that people give for disclosing or not disclosing some information about their health. So let's just talk a little bit about that. In terms of disclosure reasons, we went through the literature, and you see things like, I had to explain why I was absent so often, so I disclosed. It's just a part of who I am. Telling others is no big deal to me. I felt my job was secure and it was safe to discuss. Others noticed changes in my behavior and asked if there was a problem. My health was getting worse. I needed to say something. Others at my workplace had discussed their personal needs and the response was positive. So right away, you can see there are all kinds of different reasons people are given for disclosing some information about their health. What about not saying anything? Why do people decide they don't want to say anything at all in the workplace? Well, I can manage at work without others knowing, so I don't say anything. Or I was concerned about losing a chance to be promoted and didn't want to say anything. Nothing can be done, so there's no point in discussing. I've had problems in the past when I disclosed, so I didn't want to say anything. My health doesn't affect my ability to do my job. Why say anything? It's my business. People don't have the right to know. So you can see already the kind of conundrum we were facing with all these various types of reasons for sharing or not sharing information. What do we do about it to try to make sense of all of this mess? Well, research has focused on two factors, two primary reasons behind a lot of disclosure decisions. The first is need. Those who experience more activity limitations, pain or fatigue or other symptoms are more likely to disclose some health information at work. The second big factor that seems to be behind a lot of decisions is perceived support. Those who believe their workplace is supportive are more likely to share their needs. A number of the reasons I had put up on those previous slides did touch on some of those, this need and support, but there were reasons about past experiences, about current and future concerns, personal preferences, the nature of the job. They don't seem to be captured entirely by these two factors, need and support. So we wanted to take a look at the range of reasons people give for sharing, the importance of these reasons to workers, and then make the link, if we could, to whether the reasons matter. Do they link to the outcomes people tell us about? So in other words, we have a lot of information about why people say they are saying something or they are. We don't know very often whether or not people subsequently are feeling that this was the right decision, it resulted in a positive outcome or a negative outcome. And so we wanted to make that link with our study. To help us, we needed some way to make sense of all these different reasons. So we went to the psychological literature and to communication theories. There is a theory called the disclosure processes model. It's aimed at communication decisions in general, communication of personal information. And they discuss communication decisions being governed by two overarching goals. People will tend to have approach goals, where they're pursuing some sort of rewarding or desired end state. So I want people to like me, I want to build trust in a relationship, I want to keep doing a good job, I need some help. So these are approach goals, examples. Avoidance goals are also important to decisions. People are trying here to avoid a punishment or avoid some kind of undesired end state. So I may say something because I'm concerned if I don't, I might get fired for a poor performance. So both a decision to say something or not say something can be governed by these approach or avoidance goals, although the theory does tend to emphasize the communication piece. The reasons behind why these goals make a difference are that they can impact subsequent events. So your decision can introduce new information or withhold information that may be considered important. It can alter how others think of us, influence whether we receive support and the kind of support. So in some way, they're changing the dynamics of future interactions. So we wondered if we could use this theory to help us to look at people's reasons and study them in more detail. So our research questions for the study were, what are the approach avoidance reasons that people give? And are they associated with positive or negative outcomes? Looking at and controlling for other kinds of factors that we know may be important to people's decisions and the outcomes they have in terms of their support they receive. We conducted an online cross-sectional survey, so one time only. The eligibility for the survey was being over 18 years of age or older, people being employed for at least 15 hours a week, and unfortunately we didn't have funds to translate the survey into French, so people had to be comfortable with an English language questionnaire. We recruited individuals from a national panel of over 100,000 Canadians, and we were aiming to get similar proportions of women and men so we could make comparisons based on gender. We also wanted to have the full life course of employment. So we wanted to have people in a younger, middle-aged, and older age group. And of course, we were focused on people who were living with chronic physical and or mental health conditions. This gives you a little bit of information about our sample. The first thing to note is we had nearly 900 individuals, 896. And if you look along the blue ribbon at the very top there, that row, you'll see that our sample roughly broke down into nearly half and half. We had 459 participants who said they had told their supervisor something about their health in terms of limitations their health could have on their work. We had 437 individuals who told us they hadn't shared any kind of information about their health or any limitations with their supervisor. In terms of looking at whether those groups differed, those who had disclosed or did not disclose, there were no differences based on gender, education, job sector, or hours per week. These groups, they were as likely to disclose or not disclose. We did see an age difference. Individuals who were younger were less likely to have disclosed some health information to their supervisors than workers who were older. This may be explained by some differences also in their work characteristics. People who had worked for longer, had a longer job tenure, were more likely to have disclosed. Individuals who worked contract work were less likely to disclose it. So our younger workers tended to have less job tenure and were more likely to be working contract work, which may be explaining why they were less likely to disclose. People who had more job stress, who perceived their workplace as supportive, who had more accommodation needs, and who had been away more frequently in the last 3 months were more likely to have disclosed. So this speaks back to some of what we were seeing in previous studies where need, like accommodations and absenteeism and stress, may be driving support as well as support through things like longer job tenure, perceiving your workplace as supportive. So we're starting to see some of that here as well. What we did in terms of looking at the reasons people gave us for disclosing, so we went through a lot of that literature that I spoke about earlier, and we created various statements. And in terms of those who had disclosed, they were shown 10 different statements and asked whether each of these statements was important in their deciding to share information. So an individual could check more than one. They could check all of them if they wanted, or only a couple of these. We didn't divide them into approach or avoidance reasons, but I've done that here to give you just a sense of how things look. So we had 4 reasons. These are 3 examples that we felt fit with approach reasons from the communication theory that we were using. I felt my job was secure and it was safe to discuss. I wanted to make changes to my job and get support. It's not a big deal. It's just a part of who I am. Avoidance reasons, we had 6 here that we drew from the literature. I had to explain work absences. My health or disability was getting worse and I needed to disclose. Others noticed changes in my behavior and asked if there was a problem. So these are some of the reasons for disclosure. We did the same thing for people who hadn't disclosed. We had 10 statements from the literature. Here we ran into a little bit of a difficulty because it was hard to come up with approach reasons for not saying something. We felt that these 2 reasons, I can manage at work without others knowing, my health or disability doesn't affect my ability to do my job. These were really reflecting that there was a positive status quo that people were trying to maintain. Things are going well. I don't want to mess it up. And so these are my reasons for not saying anything. A lot more reasons in the literature fit avoidance, the avoidance category. I was concerned about lost opportunities for a promotion or new job tasks, so I didn't want to say anything. My past experiences make me concerned about sharing, and nothing can be done, so there's no point in discussing. Sense of helplessness. Here again, people were asked if each statement was important, and they could check more than one statement was relevant to them. We also needed to come up with a way to measure the outcomes for disclosure. What happened as a result of saying something? We went through the literature, did not find any measures or scales that were looking at this, and so we created some items ourselves. We had 13 items for disclosure, 13 for non-disclosure. They were roughly balanced. So people were asked, in this case, as a result of disclosing, they were given these statements and asked if they disagreed or agreed that this is what the outcome was. So, for example, there was greater understanding of my personal needs once I had disclosed. I didn't need to hide who I really am from others at work. There was less stress, but also some negative outcomes. I have to spend more effort to prove I'm as good as others. Others focus on my difficulties and not my skills and abilities, and I've experienced rejection or stigma. Similarly, for those who didn't disclose, we asked them what the outcome was. People see me more positively as a result of not disclosing. They focus on my skills and ability. They don't gossip about my personal situation. Or I'm more stressed. I have to hide who I really am from others, and I've experienced rejection or stigma. We took the statements. We did an exploratory factor analysis to confirm that really what we were seeing here were two dimensions, a set of positive outcomes and negative outcomes. And for the most part, we did get that. I provided here something called a Cronbach's alpha for those who are interested. It is over 0.8 for both of the disclosure outcomes, which is excellent. It is lower for the positive support outcomes, only 0.66, which suggests these items are not exactly all measuring the same theme, but we went ahead and with using it as a single scale. You'll see here that the average scores for what people in the two groups, the disclosure group and the non-disclosure group, gave us. In both cases, the average scores are higher, suggesting people agreed that they had positive outcomes or were more likely to agree they had positive outcomes, regardless of whether they had disclosed or not disclosed. So we see 3.4 for positive outcomes, 2.7 for negative, 3.6 for positive of non-disclosure, and 3 for negative outcomes for not disclosing. I want to just quickly show you in terms of the most frequently endorsed reasons. What did we see? When it came to the disclosure reasons, most commonly endorsed were people feeling that their job was secure and it was safe to discuss. And again, it not being a big deal. It was just a part of who I am. So neither of these really fit with the need or the support, though the first one, the job was secure, it does touch on support issues. But they're slightly different. We're capturing here some different concepts. Less likely were people saying they wanted to make changes to their job and get support. We also had over 60% of people say that their health or disability could affect their job. So some proactive thinking here, so they let others know. Others noticed and asked if there was a problem and health and disability getting worse and I needed to disclose. These were reported by just under half of individuals. For the non-disclosure reasons, 3/4 of participants said, I can manage without others knowing, and over 50% said their health or disability didn't affect their ability to do their job. Avoidance reasons, most common were not the fears about losing one's job, although we had a sizable minority report that, but that people didn't have the right to know. This is private information. More of concern to me was that we had over 50% of people say nothing can be done. So there's no point in discussing. So this sense of feeling helpless and that no supports are available when one has a disability is of concern. I think we do need to be thinking about that and addressing it. So this is the final analysis. I just want to present these tables here. We put into one large multivariable analyses all of the variables you see on the left-hand side. I didn't provide all the data to just try to keep these tables a bit simpler. I've only provided the significant betas and confidence intervals. But let's go through it. This is the analysis for the people who had disclosed information about their health. What we found was that women were less likely to tell us they had positive outcomes. No differences based on age, education, or disability type. Those with less work stress and more workplace support were more likely to report positive outcomes. And the more approach reasons people endorsed, the more likely they were to say that they had a positive outcome at their workplace after disclosing. When we turn to negative outcomes, here we see that the more work stress, the less support, the more a person needed accommodations, and the more absenteeism they reported, the more likely they were to say they had negative outcomes. And now individuals who had reported fewer approach reasons and more avoidance reasons also told us that they had more negative support outcomes. So a number of factors are associated with outcomes. And interestingly, the reasons that people are giving are some of those factors that seem to be playing some kind of role here. When we looked at not disclosing, so among individuals who said they did not say anything to their workplace, what was associated with positive outcomes? The only two variables were that the more approach reasons and the more avoidance reasons you reported, the more likely you were to say that you had a positive outcome. Why do we get both? I think it may be because in this case, what people are saying is, in terms of approach reasons, it's not affecting my job. I can manage this without it having any big impact. And I managed to avoid getting in trouble or people thinking of me in ways I didn't want them to. People aren't gossiping about me. So for people, I think here the whole package for them is a positive outcome. When it came to negative outcomes, now we see type of condition making a difference. Individuals with mental health or both physical and mental health conditions were more likely to say there was a negative outcome at their workplace when they hadn't said anything about their condition. I'll come back to this. People who reported more stress, less support, and more accommodations needed were also reporting more negative outcomes when they didn't say something. The fewer approach reasons you had and the more avoidance reasons, the more likely you had a negative outcome. And so here now what's happening is people are saying, I want to avoid people gossiping, or I don't want to lose those opportunities for a promotion, but they're not endorsing those items that their condition is not having an impact on their health. So that's a lot to take in. Let me just go through some of the summary points here. Again, just a reminder, this is really one of the first studies to try to look at reasons and outcomes, and we tried to do it in a very simple way with just some approach and avoidance perspectives, so we could capture something different about reasons. Most of our respondents did have multiple reasons. They didn't just select all approach or all avoidance, but they had more than one reason for their decision. And these reasons capture issues that go beyond need and support around identity, controlling information, experiences, helplessness, and so on. There wasn't a single right decision. As you recall, people reported positive outcomes when they disclosed, and people who reported positive outcomes when people had chosen not to say anything. I don't want to suggest that just thinking happy thoughts will cause a good outcome. I think this is a much more complex scenario that we're seeing here, but it does suggest that the decisions, the reasons may be capturing information that gets introduced into a situation that may have an impact, or people may be assessing their workplace in terms of responding to the fact that they can see others have had poor experiences or their concerns, and that may be driving some of this. But either way, people are picking up on something that seems to be meaningful here. The mental health findings were interesting to us. We didn't see mental health conditions resulting in more negative outcomes when people disclosed. Now, we don't know if people shared that they had a mental health condition. We just know that we didn't see differences between the type of condition, and it may be simply people said, I'm having some difficulties, I need some support, and they didn't explain what it was. But what we are seeing here is that among individuals with mental health conditions, there were more negative outcomes reporting when someone didn't disclose. We would never suggest you should disclose to your condition to an employer. But these data are actually supporting some other studies that we're also seeing, some of the qualitative literature. For example, one of our studies, we spoke to workplaces, supervisors, disability managers, HR, union representatives. Workplace representatives reported that one of the most difficult challenges they encountered were when individuals with likely mental health conditions were experiencing symptoms, but those individuals either weren't aware of them or were denying a problem that was happening in the workplace. what seemed to be going on, and there is some other evidence for this as well, is that sometimes symptoms are being leaked. People are seeing signs of problems, often through absenteeism, not getting work done, interpersonal issues, because they have no information that there is a health condition here that may be at play. What's happening is people are jumping to other explanations, assuming that there's a motivation problem or a negative interpersonal style. So we want to work more to understand some of the consequences of not sharing information and how we can help people to share maybe what they need and when might be a good time to do that, to get support so that people aren't misunderstanding or misinterpreting what's going on. So going forward, we want to continue to tap these factors and help people understand communication decisions and what might be right for them. And this is really what the ACE project is all about. This grant is accommodating and communicating about episodic disabilities, the ACE project. You can see the research team. It's a very multidisciplinary group. We also have a number of partners who are working with us. And our goal is to create tools and resources. We have a job demands and accommodation planning tool. This will be online in the new year for additional testing and available later this year, or next year rather. We're also working on a communication decision-making tool to try now to bring all this information together and help people. We have a website if you're interested in learning more about our studies and participating. All the tools that we create, we want to be very personalized and interactive and of course based on evidence. We're not going to give advice, but we want to help people work through questions that they should ask themselves and give people ideas about avenues they can take going forward. In terms of the communication areas, and this is my second last slide, we want to cover what is your current situation. Why are you thinking of sharing information now? Get at these goals in sharing and not sharing information, and what matters to an individual in terms of understanding their personal preferences, what they need to consider about their job and organization, and overlay some of this approach avoidance research we've been doing, and then help people think about when they should say something. That was a lot to take in. So I'll just put this slide up now and I'll stop and we can take any questions. Thank you very much.
Thank you, Monique, for a great presentation. We already have a few questions in the question box, so I will start with those. One was about asking if there will be a tool to assist workers, and I believe you did mention, Monique, that there will be one in the new year, and so if people want to keep track of the ACE website, they will see that tool when it's presented. Another question was about, did you collect information on the industry where people were working or the position that they held, and whether that made a difference in decisions to disclose or not to disclose?
We had, yes, thank you. So we had broad job sectors available to us that didn't make a difference in terms of whether to disclose or not disclose. We had other information as well, whether a person had supervisory responsibilities, whether they worked in a unionized environment. We do have job title. We haven't gone through and coded all that information yet. At this point, those characteristics of a person's workplace did not make a difference in whether they disclosed or not. We need to do further work to look and see whether or not we're seeing any differences in being more or less likely to report approach or avoidance reasons. And we also want to look at the support outcomes in more detail based on those factors. But unfortunately, sir, I don't have details there.
Okay, great. Another question, which was around, so the presentation today gave the perspective from the worker's point of view. Has there been work, or are you planning to do work which would take into account the employer's perspective, and in terms of trying to bridge the gap between employers and employees?
Yeah, so it's a good question, and there is not a lot of research out there that takes into account the employer perspective. It's growing. There are some qualitative studies, and we've done one of those studies. So we looked at 27 different workplace groups. Again, this was HR, supervisors, managers, union representatives, some labor lawyers. We asked them about the communication processes in their workplace and what some of the challenges were from their perspectives. And that paper is available, and it was on one of the earlier slides. So when the slides are made available, you can find the reference for that. I will say that there were a number of themes that emerged related to the role of others that highlighted the complexity of the decision. So it often wasn't just a supervisor who was involved, but it was others, and people talked about how that process sometimes broke down or didn't, with depending on who was involved. And then this is where the real challenges in not disclosing came up. The second factor, in addition to when someone doesn't say something and they're confronted, was the problem with non-disclosure, often related to disability now being cast as a performance problem, and being unable to move away from this always being discussed as performance instead of disability support.
Right. So we've got quite a few questions in the chat box now. I can summarize some of them, which are sort of around the disclosure event or events around disclosure. So one is around, did you collect information on partial disclosure? So when someone disclosed to some people but not to one, or how, in particular, people wanting information on how the disclosure, if it was a successful disclosure, how was it, I guess, how did it occur?
So we don't, so we have some information about who were the people disclosed to. So we know that people were more likely to disclose to colleagues, co-workers in their workplace, least likely to disclose to, for example, human resources, which made this, I think, a very much more official kind of on the record kind of disclosure. And supervisors, managers fell in between. We don't have a sense of how much information was disclosed. We know privacy laws mean that people don't have to disclose the actual diagnosis or symptoms. We don't have a good sense from this particular study the details of what they disclosed. We do have some information about again, whether this people were supportive, whether people told us they received accommodations as a result of disclosing or sharing, and that you are more likely to get support if you have disclosed than if you haven't said anything in the way of formal accommodations. But because this was a large survey, we don't have the details about that process of support. That's something that really needs to be unpacked. And again, there are some studies that are starting to do that.
Great. Question, could there be a self-fulfilling prophecy effect with respect to the perception of positive and negative outcomes in the study?
Mm-hmm. It's an interesting question, and I would say yes. So what just to explain for people who aren't maybe sure what we mean here, there's a lot of data out there that if you approach something in a positive or negative way, your behaviors have an influence on others, and they can help, something becomes self-fulfilling. So I approached this in a positive way, assuming I was going to get support, acting in a way that was very open and upfront and again, positive. And as a result, I tell you that, in fact, I had positive experiences with that. If I approach others in a negative, untrusting way, I don't think you're going to be helpful, I don't expect anything from you, I may appear more confrontational, and in fact, I may set up a situation that becomes more confrontational. That's certainly something that the theory, this communication disclosure processes model, talks about as being one of the ways people's reasons may matter in terms of going forward. And I certainly think that there's evidence elsewhere to support that. I would want to caution, though, an assumption that if I go forward and I say things and I act in a positive way, I will necessarily experience that back from others, because we do know sometimes people in good faith share and they don't find that they get a positive response from other individuals.
Okay, so this question is more of a comment, but I think it's maybe one that you might want to provide an opinion on. So it said it would be nice if a worker could feel confident that their decision to disclose would trigger a standardized process in which their rights were protected. I guess, do you have any comments around that statement?
I absolutely agree. And I will say that that is, I think, some of what's behind this ACE grant. That in creating what we hope will be tools and resources, and by the way, there'll be tools and resources for workers as well as workplaces. So one of the tools I mentioned was this job demands and accommodation planning tool, which provides a standardized way for people to look through various job demands and a lot of different support ideas, self-management, things people can do on their own, formal accommodations, so we can help people to maybe all start from the same place. The same with the communication tool. We do want to create something that would be there for workplaces. So actually supervisors can understand their own perceptions and biases and their immediate responses, good or bad, to workers, as well as give the workers something. So that, again, we have maybe at the end of ACE a toolbox that all parties could be using to try to get to that point where you have maybe less risk in feeling like if I disclose, this is the end of everything for me, or if I don't, I'll be caught out and still find I have troubles.
Okay, so this question's about, so you noted that you weren't suggesting that the initial decision caused the outcome, but did you see or did you sort of feel that disclosure and non-disclosure were more mitigation tools to prevent negative outcomes occurring?
I'm not, sorry, go ahead, Peter.
I was just going to say, did you feel that people were disclosing or not, I guess, as a way to prevent, I guess, something worse occurring in the future?
Yeah, and I think in terms of, and those would be sort of more of those avoidance reasons that I think that we certainly see the avoidance reasons, the more serious ones, like I was afraid of getting fired. You know, people started gossiping about me and I had to explain what was going on. We're absolutely seeing people endorse those kinds of reasons, but it was of interest to us that not as frequently as some of the other reasons around the protection of private information that I feel is my own and I want to control, or some of the I'm seeking to get support in a proactive way before things all kind of unravel. So they're there. They're a significant, or I shouldn't say significant, a sizable minority. And so I think they are important. And this is where I would like, as in subsequent analyses, to be able to go in and look at some of those reasons and unpack them. Are they related to certain job sectors? Is this where men and women differ or younger workers are different? So we can perhaps target some of these communication tools more clearly to certain groups where there may be enhanced risks.
And I guess, and so a related question just around the disclosure, the approach for disclosure. Did you know that people were using disclosure as a way to include advocacy? So to a responsibility to educate people about their condition and what could be done or what, you know, doesn't need to be done in relation to their condition?
In this study, we didn't have, I think, the questions to really tap that. We did ask some people, you know, this is just a part of who I am, and we heard that. That was drawn based on some of our qualitative research, where we absolutely heard a number of people, probably though, again, not the majority of our participants, but for a number of individuals, there really was a sense of it's important that others understand that people living with disabilities are good workers. They're able to do their jobs. And so often not right away, but over a period of time, people told us that they had become more advocates. Usually, again, older workers or middle-aged or older workers who had a history with a workplace where they felt safe in saying, look, you don't know it, but I've been actually working with X condition for a number of years. And people responding very positively and then being, taking on this advocacy role.
So I've got two questions here which are related to the outcomes. So was any information captured on when people did disclose, if how well accommodations, if accommodations were offered, if they were satisfactory accommodations or not?
I think that's one of the limitations for sure of this study. Being a cross-sectional study, we weren't able to look at, did the subsequent support result in less absenteeism, receiving more accommodations? And that's something we need to do for with our longitudinal research. This study, unfortunately, was just a one-time snapshot, and we couldn't tease out whether the accommodations were linked to the disclosure itself. The best we could do is say they were linked, likely that you felt you needed an accommodation, so you disclosed, but we don't know whether receiving the accommodation resulted in better performance, for example, or help people sustain their jobs. But that's something that definitely needs to be done.
Okay, another one about the study sample. Do you think there's any selection bias in the study sample where, I guess, people who don't recognise they have a disability wouldn't really participate in the study, or recognise they have a condition that needs to be accommodated, wouldn't participate in the study? So I guess any comments about that potential in the sample?
It's a good point. We never use the word disability in any of our surveys and in any of the ways that we're recruiting for respondents, because that word just doesn't resonate with most of the individuals who are in our study. So we ask typically about, we'll advertise that we're looking for people who are, in our case, living with various kinds of chronic conditions. We also had a group of people who had no chronic conditions actually in the sample. I just didn't talk about them today. So we'll recruit looking for people who are living with conditions, and then we'll ask whether or not a condition ever limits the person's ability to do their job or creates difficulty with particular job tasks. So that word disability is off the table, and that way we're more likely to hear people say that yes, they have limitations. We sum this up as people who are living with a disability, but yes, there would be a lot of people who would say, I don't have a disability, even if they answered yes, that they had limitations to the questions we asked in our study.
So we've spoken a little bit about some of the tools which are being developed through the ACE project. There's a question here around a tool that would support managers or human resources professionals to broach the topic with individuals they may be concerned about in terms of an underlying health condition. Are there any tools like that being developed through the ACE project?
We are, sorry, 1 second here, just having a problem. We are developing, I guess what I would say is more like a toolbox that we're looking to have people, so it's not just the communication, should you or shouldn't you, but also once you've made a decision not to say something or to say something, are there resources where you can go to? Are there things that you can do, templates to help people broach topics? And again, that would be for the worker as well as the workplace, so that people will be able to address to a worker, go forward and ask a worker, is there something that maybe we could talk about? You don't seem to be acting yourself. What could we do here? So that is something that we want to do as part of our going forward.
A question here, someone saying that as someone who had a highly stigmatized episodic disability, it was easier for them to disclose when they were in the recovery process. Did you collect any information on where people were in terms of their disability onset, if they were receiving treatment, and how that made an influence in the decision to disclose or not disclose?
We have not a lot. We have some information about current experiences with these conditions. Because so many individuals report, a kind of an ongoing trajectory, it wasn't easy to kind of find out from people. We know, again, we have some of this kind of recurrent fluctuating, so we know that people are not likely to be in a situation that's very stable for a long period of time. But we don't have at this one snapshot where they were at this particular time.
Okay. Is there questions around, I guess, the disclosure piece, the accommodation piece? It's sort of an ongoing process. Are there guidelines or information about how often someone should be followed up with in terms of accommodations when it comes to medical conditions? If someone has a permanent impairment, should they be followed up at all? I guess, do you have any thoughts on that particular topic?
That was one of it wasn't addressed in this particular questionnaire, but it was something we certainly spoke to workplace parties about in terms of what their thoughts were. We had a lot of variability in what the responses were there. There were some, once there had been an episode in a workplace, were some workplaces that did try to follow up every few months, sometimes more, until things seemed to settle down, and then with further spots in between. We had some workplaces say, workers really shouldn't say anything until there's a crisis. So the notion of the proactive seemed to be something they didn't think was necessarily helpful. Other workplaces disagreed. So I would say what we're hearing at this point is all coming from workplace parties, and it's quite variable. We don't have data yet to suggest that one of these approaches is better than the others. It's something that is worth pursuing. We think that because it is, these are episodic conditions, that one of the issues that arises that is a problem is that sometimes workplaces will say, we spent a lot of time setting something up with someone. It was fine for a few months, and then we had to go back to the table once again, and we're worn out, and we're worried now we've hit a situation of undue hardship. So I think there's a lot of education pieces that need to go into living with an episodic disability, so that there's an expectation that, yes, you will have to be back at the table here, you will have to revisit these, and the following up is a good thing to do. It's just part of what this process is. It's not like this is necessarily the beginning of the end if you have to revisit.
So this is sort of two questions loaded into one. Is the stigma around disability a barrier to employers responding to disability? And if it is, have there been considerations about awareness or educations, sort of a softer approach to a more inclusivity approach around people with disability in the workplace, as opposed to sort of a calling out of people with disability in terms of work?
That's a big comment, a big question. I would say that from what I know in the literature, there is a lot more attention to stigma, what it looks like, that there can be various types of stigma. It can be systemic. It doesn't necessarily mean one person responses to another. So the complexity around stigma is something that is getting more attention. I think workplaces are wanting to be more inclusive. It's not entirely clear how to go about this. There is more education going on. I think we need more awareness. And the awareness, I think, needs to be related to maybe not just focus, and a lot of times it shouldn't just be focused on the condition. Can we provide support and accommodations for people not knowing the details about a condition? Some workplaces are saying, absolutely, we really can. I don't need to know whether this is mental health or physical. You don't need to tell me. Others are feeling like that diagnosis makes a big difference. We certainly have laws about what you need to know and safety. So this is, I think, a complex area that is being worked out. I wish I had more of a solution around more ideas around the stigma and how to deal with this better. But I absolutely agree, education and awareness is a big part of it.
And just, I've got time for just a couple more questions, Monique, and then we'll sign off for today. One is around, I guess, issues around, in terms of people and their interaction with a healthcare provider, such as a doctor. Is there any guidance to assist with the appropriate type of communication that healthcare provider can do with the workplace in order to keep confidentiality but avoid negative responses from employers?
Yeah, that's an important point, because very often physicians are brought into the disclosure support process. That's one of the reasons why we wanted to create this JDAPT tool, this Job Demands and Accommodation Planning tool. It would be something that would allow clinicians with their patients to complete, and again, provide that kind of baseline, that way of discussing accommodations where a condition wouldn't need to be disclosed. We do hear from workplaces, some are trying to actually not bring in clinicians right away. Others need to verify what the condition is. We know from workers that there's a reluctance sometimes to declare that a person even has any kind of disability, because that letter you get from a clinician could out you in some way. So even though I don't have to tell you what my diagnosis is, if the letter comes from a psychiatrist, it's perhaps clearer that this is a mental health issue. So the toolbox we're creating, we're hoping that this would be something that clinicians could use as well, again, to avoid having to provide a diagnosis to someone to confirm that there is an issue, and also to help provide a better sense of what the supports and the limitations might actually be.
Okay, so I've got a couple of very quick, they can be answered, I assume, relatively quickly, and then we can, because we're running out of time at the moment. We have one of the members of the audience had a claim denied by the WSOP. How would they disclose the disability to the employer? If you had thoughts on how that might happen.
I unfortunately don't. The specifics there, I think we'd need to hear more about. Very sorry.
Potentially through the healthcare provider.
Yes,
and just
although
a few more around just around the condition type. Was things like addiction and alcoholism, were they considered chronic and episodic disabilities, especially if someone's taking active steps in terms of managing those conditions?
Certainly in the qualitative research, addictions are considered mental health conditions that would be captured by what we're doing. In this particular survey, we didn't get the specifics of what the condition are, but if an individual said that they had a mental health condition and they were thinking about an addiction, they would have been included in the study.
Okay, and would the mental health conditions also have included neurological disabilities like cognitive impairments, or were they captured separately?
We have considered those. We've considered developmental disabilities, various kinds of neurological conditions as being potentially episodic. Some of them are quite continuous, and a lot of our focus has been on the changing conditions. So it would depend on how constant versus variable they are in terms of whether they were included in this particular study.
Great. Thank you very much, Monique. We're right on time. Just a reminder to members of the audience, this is the last of the speaker series for this calendar year. Our speaker series will resume again on January the 12th. More information on that presentation will be up on our website shortly. The web address is on the bottom of Monique's slide there, iwh.on.ca/events/speaker series. Thank you very much again, Monique. For those of you who are interested, this webinar and the presentation will be posted online within the next couple of weeks. So please go back to the IWH website if you want to pass on information about the presentation, and if you want more information about the speaker series, please subscribe, and the link is also on the next slide. Thanks again, Monique.
Thank you, everyone. Take care, everyone.